This presentation will address the focus question, how is injury rehabilitation managed? It will focus specifically on return to play, and it's part 2 of a 2-part series. The presentation will address psychological readiness, specific warm-up and cool-down, and return to play policies and procedures, and also ethical considerations. Psychological readiness is the mental, emotional and psychological state of the athlete. It refers to confidence levels, self-esteem, motivation and self-assurance. It can be measured through interviews, discussion and observation of performance. It can also be supported by taping and bandaging particular injured body parts, such as an injured ankle. Psychological readiness is important because an athlete must feel confident. They must feel that they are ready so that they can achieve to their full potential on the field. If they are lacking confidence, they're likely to hold back. They're probably more likely to use incorrect technique, and this could further enhance the risk of injury. Specific warm-up procedures include testing the injured site under competition conditions. So a specific warm-up should be longer, it should be specific, it should go for a little bit longer than what a warm-up should normally. It may need to include special considerations to ensure that the injured area is protected. It ensures increased flexibility and blood flow, and it allows the athlete to be physically and psychologically ready to perform. The importance of a specific warm-up when returning to play. The example here from an athlete returning, a sprinter returning from a hamstring injury, obviously jogging and dynamic stretching should prepare the quadriceps and hamstrings well. Muscles should be extended in a safe environment beyond what would be demanded in a competition. So the athlete really should be putting themselves under some pressure, extending those muscles to ensure that they are actually ready to return. This will ensure elasticity, full range of motion, and increased blood flow and temperature, and ensures physical and psychological readiness. Return to play policies and procedures vary across different sports, and they are developed in combination with coaches, sports administrators, sports doctors, governing bodies and individual sporting clubs, and it really depends on the nature and the severity of the injury. Priority must be given to the welfare of the player, and medical advice should always guide decisions. The NRL has a specific return to play policy, and if we have a look a little bit closer here, you can see that there are a range of conditions that require medical clearance before they can return. So the NRL's policy is that never allow a player to return to the field if there is any doubt of further injury, and it indicates the conditions that require a medical clearance. Various elite sports have similar policies, and so these policies need to be adhered to by all levels within the particular code. Concussion is an area of concern in contact sports. It involves disturbance to brain function caused by trauma. It can be dangerous if the player is returned to play too soon. It can lead to headache, poor alertness and unconsciousness. It interferes with how the brain works, and this can affect memory, judgment, reflexes, speech, balance, coordination, and sleep patterns. So it's very important that a return to play policy is followed following concussion, and most contact sports do have concussion policies. You can see here in this image that concussion results from an impact to the head, which leads to the brain colliding with the skull, which then leads to bruising, torn tissues and swelling, and can lead to headache, dizziness, confusion, and so on. Second impact syndrome is what occurs when an athlete returns to play too soon, and this is where serious brain injury can occur. So that's why these policies, particularly for concussion, are so important, because if someone has experienced a concussion, they should not be returning to play. The NRL, of course, is a heavy contact sport, and it has a very specific concussion policy. On the field, tests are conducted by trainers, and that is called the concussion recognition tool. It's a very simple test. If the player doesn't pass, they then see a sports doctor, and the sports doctor will conduct what's called the Sports Concussion Assessment Tool number 3, or the SCAT-3 test. If concussion is determined, then the player is not to return and the return to play procedure is followed. All of this documentation must be submitted to the NRL for examination, and if clubs return players too soon, they can be fined $20,000. Now, the AFL and the NRL both have a very similar concussion policy and rehab procedure. So any athlete that has a concussion must go through the tests that have just been discussed, SCAT3 and concussion recognition tool. If concussion is determined, they must rest for a period of time, and graduated return to sport takes place for 24 to 48 hours after the symptoms have passed. They then can only move into light aerobic exercise such as running, and they must only take part in non-contact drills, and it's only after a period of time that they can actually return to training, experience full contact, and then finally return to the game. And this is to avoid the second impact syndrome as discussed earlier, which is so serious and can lead to brain damage. So the pocket concussion recognition tool is put in place as part of the concussion policy of a range of sports, including rugby, rugby league, AFL, soccer. Trainers and coaches conduct a simple observation and memory test. If the athlete does not pass these tests, it is deemed that they have experienced a traumatic brain injury, and so a medical professional is required. They will then conduct the SCAT3 test, Sports Concussion Assessment Tool, which involves a more detailed test around balance, coordination, vision, cognitive, such as questions, memory tests, and neck and spinal examination. The SCAT3 return to play guidelines are listed here, and these guidelines are followed by all of the contact sports that have adopted this as their policy, such as NRL, AFL, and rugby union. Now, when athletes are returning to play, they often experience pressure to participate. Often talented players experience pressure to participate because they are so important to their team. Along with this pressure comes the lure of using injections to mask pain. Players in today's society are often treated as commodities, particularly in elite competitions. And returning to play too soon is unwise and dangerous. Pain in an injury indicates tissue damage, so it's important for players, coaches and trainers and medical professionals to understand that pain is a natural part of the inflammation process, but it indicates that more healing is required. So athletes shouldn't be pressured to participate when they're not ready, because it can make the injury worse and lead to permanent damage. Players often experience internal pressures such as boredom, the drive for success, the fear of losing their position or letting down the team, or it could be other things like the fear of not being able to perform to their best, which affects their self-esteem. External pressures are also quite important, and financial pressures, so the lack of ability to earn money if they're off or they're out of play. The media, sponsors, opposition, family, coaches, spectators are all external pressures. Ethical considerations really come down to what is right and what is wrong regarding return to play. So when should a player return, and whose welfare needs to be considered most when the decision is made? So who makes the decisions? When is it the right time to return? What are the consequences? These questions need to be answered by all of those involved. It's a very, very difficult decision to make, and players, trainers, medical practitioners and coaches all need to be involved in the decision-making process. All of these people need to understand the long and short-term consequences, and the understanding that if an athlete returns too soon, further complications can occur, including longer recovery periods and possible long-term damage. With pressure to participate comes the use of painkillers. Painkillers are substances that reduce pain or eliminate pain. They can be over-the-counter, prescription, or they can come in the form of injections. They all mask pain, and so this can be dangerous because pain is a natural response to inflammation and injury. So it's important to know that painkillers should only be used when they are medically justified and when there is no risk for further injury. Why are painkillers dangerous? They desensitise, they mask pain, and the player can do further damage without knowing it. It can actually extend the recovery time and make the healing process longer, and it can lead to permanent damage of muscle fibres. And they should only be used when medically justified and when there is no further damage that can be done to an athlete. The use of painkillers are becoming more common in sports, mainly because of the pressures that we spoke about, the internal and external pressures. They can be attractive for athletes because sporting clubs rely on particular athletes to obviously perform well for their team to win. Advances in drug technology have also led to better and more effective painkillers. The ethical dilemmas that may occur as a result of painkilling injections. Key players, often the best players in a team that may get injured when an important match comes up, painkillers may be considered so that these really good, effective players can get through the match. So the question needs to be asked, should the team prioritise winning over the safety of individuals? And it's a decision that needs to be made by the individual, the team doctor, the trainer and the coach together, with long-term consequences considered and the future of the athlete. In the NRL, we often see players being removed from the field, going up into the dressing rooms and then coming back, seemingly seriously injured and then coming back into the field of play. So I guess there are many examples week to week of these ethical considerations. Should the athlete's welfare be prioritised, or does the priorities of the team take precedent over that? So these ethical dilemmas are in play in elite sport all the time, but it's really important that the welfare of the athlete is prioritised. The critical question: critically examine policies and procedures that regulate the timing of return to play, considering questions such as, why aren't such policies applied to all sports? Okay, contact sports will obviously have different policies and procedures to a non-contact sport because of the injuries that take place and the potential injuries that could occur. Who should have ultimate responsibility for deciding if an athlete returns to competition? As mentioned, it should be a decision made by a range of people, including the athlete, the coach, the medical professional. And should athletes be allowed to use painkillers in order to compete when injured? And as mentioned, these painkillers should only be used when medically justified and when the welfare of the player is prioritised and when no further injury can occur. Thank you very much for listening to this presentation.